In this lesson, we are going to see which are the possible diseases that can come from interhuman contacts while you're on a travel. You will also learn how to protect yourself and behave properly in order to avoid any illness contraction. Special attention has to be given to measures you better take against the risk of contracting diseases due to human interaction. There is a variety of illnesses you can encounter having human contacts, and the mechanism of contracting these illnesses are more than one. For this reason, we are going to focus on principal illnesses, dividing them into illnesses with prevalent but not exclusive sexual transmission, illnesses due to generic human interaction. Illnesses with prevalent but not exclusive sexual transmission beyond syphilis are human immunodeficiency virus, Hepatitis C virus, Hepatitis B virus, and Zika virus. HIV is a contagious, deadly virus that is spread through blood, blood products, and other fluids, such as semen. HIV is present worldwide. Sub-Saharan Africa remains the most affected part of the world, but there has been increase in transmission in Eastern Europe, Asia, and Central and South America. Hepatitis C is a contagious disease that causes liver damage, and it is usually spread by blood contact. Unprotected sexual activity rarely could be responsible of contagious. HCV is highly spread in Asia, Africa, but occurs in every part of the world. Hepatitis B is a contagious virus that is spread through blood, blood products, and other fluids, such as semen. There are parts of the world where HBV is most common, like Asia, Africa, South America, and Caribbean, but is spread worldwide. We also need to mention Hepatitis A virus, which is prevalently transmitted by eating food contaminated by feces, but will also have a sexual-related transmission. Infection may be transmitted having unprotected sex, receiving a transfusion of unscreened blood, having medical or dental procedure, getting tattoos or piercing, or receiving any procedure without sterile needles. What can travelers do to prevent sexual transmitted diseases? Protect yourself. Use latex condoms correctly, like reported on the pack. Do not inject drugs. Limit alcohol consumption. People take more risks when intoxicated. Do not share needles or any devices that can break the skin, clippers, razors, toothbrush. These are the attention you better take while you're traveling, and not only. Before your departure, get informed about vaccination for Hepatitis B. Ask your doctor whether getting vaccinated or not. It is recommended for travelers who plan a long-staying journey, people underlying chronic diseases, older people, and healthcare workers. Let's now move to some information about Zika virus in order to avoid any dangerous behavior. Human infection by Zika virus is mainly transmitted by the bite of mosquitoes, but virus could also be contracted through sexual contact, with transmission from the male infected to the partner. Infection itself is mild, and 80% of cases is asymptomatic, but the problem is about the transmission from mother to fetus, causing microcephaly. The disease is present in equatorial areas of Africa, Asia, and especially in Central South America. To prevent infection, travelers should avoid being bitten by mosquitoes through specific preventive measures. It is also recommended to use condoms in the course of sexual relation. Now, we are going to talk about illnesses due to generic human interaction, such as pediculosis and scabies. Pediculosis is an infestation by eggs, larvae, or adults of lice. Generally, it involves hairy parts of the body and/or clothing, so it is easily transmitted either by interhuman contacts or by sharing clothing or dressing for beds, towel, etc. We have different species of lice that can be divided considering the particular part of the body they privilege, together with their specific way of transmission. Head lice privilege the back of the head or ears, so sign of itching or scratching in these areas should lead to examination in search for larvae or egg of lice. Head lice infestations are frequent in schools. Itching around genital area should lead to an examination for crab lice, which are transmitted generally by sexual contact. Body lice are mostly found in places where clothing is infrequently changed in unhygienic conditions. Lice infestation can be transmitted even where bed dressing is not often changed or washed properly, or if laundry is contaminated by clothing with lice eggs. To treat pediculosis, you can use medicated shampoos or soaps and cream rinses after medical consultations. Scabies is a condition of the skin caused by human itch mites. The transmission is possible with direct and prolonged contact person to person with the subject affected. The contact has to be skin to skin and durable. This means that hugging a person with scabies doesn't mean you'll get infected. In fact, generally, scabies is transmitted with sexual contact or between people living together. Like we said for lice, unhygienic habits and crowded places represent favorable conditions for scabies to spread. Intense itching and small pimple-like skin rash are the most common symptoms. Scabies is often seen in developing countries and in tropical areas, but it occurs worldwide. There is not vaccine or meds to prevent scabies. Prevention consists in good personal hygiene, paying attention to contact with people who have scabies, and when going to nursing home, hostels, extended care facilities. We've seen the principal precautions for illnesses transmitted by sexual contact, blood-to-blood contact, or biological fluid contact, such as blood or semen, with skin lesions and not so dangerous but annoying illnesses of skin and cutaneous annexes. We have also talked about symptomatology of these diseases. We want to remind you that there are other illnesses potentially transmitted by human interaction. For some of them, which could be potentially dangerous, like meningitis, there are specific vaccination. In the end, some important rules of conduct for prevention may be summarized as follows. Wash your hands often using soaps. Practice hygiene and cleanliness. Try to avoid close contact and keep distant from people coughing and looking sick.